Hello, this video is a small portion of a complete comprehensive video. If you'd like to see this complete comprehensive case and many other complete comprehensive cases, click on the link in the description below. So this is the placement. Painless and profound local anesthesia is tantamount to a good practice. If you can anesthetize people painlessly and profoundly, you got to start to a really good practice. I can't tell you how many patients I see in my office as new patients, and they say, my dentist could never get me numb. They always gave me a ton of local anesthesia, but they couldn't get me numb. There's no reason for that. Watch my videos on painless and profound local anesthesia in the maxilla and the mandible. It's a technique. It's not a volume situation, it's a method. So watch those videos. So you want to first anesthetize in the maxillary vestibule and anesthetize this part of the tissue. Then you come back and anesthetize the incisal foramen from the facial first. Since this tissue is numb, if you give a patient an injection in the incisive foramen, they're going to hate you. Don't do that. Anesthetize that tissue, make it blanch from the facial, and then you can go to the palatal and anesthetize the incisive foramen. So this gentleman has upper and lower dentures already. So I'm going to use the maxillary denture as a provisional denture. When I'm placing implants, I only use the maxillary denture. I normally don't use the mandibular denture. So I'm going to mark the center of the ridge on the denture with these sanitary color transfer applicators, Great Plains dental product. And this just identifies the center of the ridge. So when I'm placing the implants, I know where the center of the ridge is. That's the maxilla. And I'm going to mark the spots. You don't want to put one into the incisive foramen. You want to put it on either side. And then back here, your limiting factors are the incisive foramen and the sinuses. There's not a problem putting a small amount or perforating the floor of the sinus. The issue is you don't want 4 millimeters of implant into the sinus, because the smallest implant is 8 millimeters. So if you've got 4 millimeters in the sinus, that just means you've got 4 millimeters in the bone. So the perforation of the sinus is not an issue. You can read the article in the library of dentistrymasterclasses.com, and they go into perforation of the sinus. It's not an issue. The issue is it's surface area. You want as much implant as possible surrounded by bone and osseointegrated by the bone. So I'd like at least 6 millimeters of the implant in bone, because these small diameter implants are small. So you don't have as much surface area as you do with a root form implant. I'm using this pilot drill, and you want to perforate the cortical plate, and these are 2.5 millimeter diameter SDIs. Now we used to get 3 millimeter width implants from when 3M had the small diameter implant division. Now they don't have it anymore, so 2.5 is the largest width they have with the implant company I'm using right now. I'm probably going to change to another one that's got 3 millimeter in diameter for the maxilla, because again, it's about surface area. But you want to use at least a 2.5, and you want to make it as long as you can, so you've got more surface area in the bone. And I use a large occlusal mirror to check and see the angulation of the implant. You don't want it sticking out facially. You want it approximately in line with the root of the teeth that were extracted. I sedate these patients intravenously with Versed and maybe a little bit of Demerol. I would suggest you sedate them with something. See, now I couldn't screw that in with that finger driver, so that means it's tight. That's the Dental Minute. These techniques work, and they work every time.
Are you ready to take your dentistry practice to the highest level possible? Of course you are! Subscribe right now to dentistrymasterclasses.com, where you will get Dr. Cutbirth's greatest work and best cases. Here's what you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos. You will get an organized library of all the Dental Minute videos and Dentistry Masterclasses, comprehensive cases for study and reference, before and after photos of Dr. Cutbirth's fantastic restored cases. And all of this, I repeat, all of this is just $40 a month. This is something you cannot pass up. Subscribe right now to dentistrymasterclasses.com.